as is to conduct the homeless count for the region, for Los Angeles. Now, we actually don't cover the entire county. We cover most of it, but the cities of Glendale, Pasadena, and Long Beach do their own counts. But we do, these are, for the most part, I'll talk about aggregated numbers across, across the county. So just looking at the context, we do this on an annual basis. We found 47,000 people homeless on a given night in January of 2016. So that is, it's a little bit difficult to interpret that data because we added a new element to the count this year, which was to do a specific count of homeless youth, which is a little bit of a confounder in terms of a methodological shift. But if you just look at the street count and the shelter count, which is what we had last year, it's about flat, less than 1% change. Overall, the number is up about 6%, but that's because we did the special youth count, which is something that HUD has been encouraging us and all communities to do. Unlike most homeless people across America, Los Angeles' homeless population is largely unsheltered. That is the inverse of the sort of national norm. 75% of the people who are homeless in Los Angeles County are on our streets. They are in vehicles, they are in makeshift dwellings and in tents and out on the street. That is, the reverse of what's actually, or inverse of what's the norm nationally. We also have a disproportionate share of homelessness, vis-a-vis the sort of national norms. As a population base, we are the most populous county in America with about 3% of American population. We have about 3 times that number of homeless relative to the U.S. Homeless population. Just looking at a few different subpopulations of homelessness in LA. One lens into homelessness that we focus on our subpopulations because they present differently, they have different needs, and there are different resources that are available for them. People with chronic homelessness, which is to say that they've been out on the street for a significant duration of time, at least a year, and they have a disabling condition, make up about 1/3 of the population. So that's relatively high against national norms. Veterans is one of the success stories locally. We have reduced significantly the population of homeless veterans on our streets, but they still constitute about 6% of the population. Veterans are at increased risk relative to the standard population. Households with children, the family members represent about 15% of the population, and they have a number of vulnerabilities that probably goes without saying. Youth, which are our 18 to 24 adults, but also unaccompanied minors, constitute about 8% of our population. And then the sort of general adult population. Now these are not going to sum, obviously, because there are overlapping categories here. But the sort of single adult population is the sort of bulk of that. If we focus in on sort of the population that has the most significant health issues, who are the people who have experienced chronic homelessness. So between single adults and households who have experienced chronic homelessness, it's about, as I said, about 1/3 of the population, more than 13,000 individuals. That's a decrease of about 5% from our 2015 count, and that is in part as a result of a focus on this population. A lot of the systems that we have put into place, including some that you'll hear about, have focused on shifting from people experiencing homelessness to people of high acuity experiencing homelessness. So we are attempting to address the folks who are at greatest risk, highest vulnerability. Very, very high percentage of them are unsheltered. And most of them score in the highest range in when we assess their needs using our service assessment tools for the coordinated entry system. Most of them score in the highest range. Obviously, there are folks who have those conditions that are relatively high functioning from a supportive service need perspective, but most of them are very high support needs. So just going through, sort of categorizing one of the other lenses that you can look at is what are drivers into homelessness. Los Angeles is sort of at a real confluence of multiple factors, but the key factor is housing. At core, homelessness is a housing crisis, and I want to, we're looking at it through the lens of people experiencing a variety of different kinds of health concerns, which definitely drive homelessness. But the pressure on folks all across the board, in terms of the tightness of our housing market, is one of the major factors here in Los Angeles. Poverty also has an impact. Clearly, health and disabilities, whether they're mental health, whether they're substance abuse, physical disabilities, traumatic brain injury, a number of different drivers, and often with significant comorbidity. Incarceration obviously has an impact on people's economic ability to get jobs and get housing, and that fuels a cycle of it's a self-reinforcing cycle of homelessness and reincarceration. And domestic violence is a significant contributor. Nearly a fifth of the population report an experience of domestic violence and sexual abuse and other kinds of physical trauma. Those are quite disparate by gender. Males report about 12%, women report about 36%. Just to drive in a little bit on the housing side, there's a state nonprofit that does analysis for state commissioned nonprofit, California Housing Partnership. They do an analysis of sort of housing gaps across all the counties. Looking at the housing gaps and affordability in Los Angeles County, over 500,000 units of affordable housing that we need and don't have. There's a tremendous gap in there. We have a relatively high level of poverty, which is, the federal poverty rates, I don't know whether you know, they're not indexed to the housing costs. When you take that step and you index it to housing costs, because housing is so expensive here, it drives almost between a quarter and a third of the population into what would be that equivalent level. And then overcrowding, which is essentially Los Angeles' answer to affordable housing, is rampant in Los Angeles. Most of the people who are in low income are experiencing overcrowding in the Los Angeles rental market. So if we're looking at health and homelessness issues, 30% of the people in our demographic survey, which covered 5,000 individuals, is a very, very rich demographic sample against a 47,000 population. 23% reported chronic substance abuse, and nearly 1 in 5 with a physical disability. These data are pretty consistent from 2015 to 2016. So this is these are pretty robust across when you look at the survey to survey across the year on year. We want to sort of look in at factors that are particularly challenging for folks. Comorbidity of mental health disorders and substance abuse is a serious driver, and when we cross these against each other, you can see that those reporting serious mental illness, the majority of them also are reporting on chronic substance abuse, and a significant plurality of those with substance abuse report are also reporting mental health issues. So significant cross connections between the factors, and those definitely have an influence on keeping people in a state of chronic homelessness. Incarceration, obviously, it plays a role. We have 20% of the population have reported being arrested in the last year. Nationally, we have formerly incarcerated folks at rates of 7 to 10 times the standard population in terms of experiencing homelessness. And 50% of the adult population that we surveyed had some history of incarceration. So if we look across systems connections for people experiencing homelessness in Los Angeles, roughly 10% of the adults had some experience with a foster youth. Chronically homeless, obviously, more of a connection with that. And when we look at youth, fully a quarter of the youth reported coming out of the foster system at some point. So, significant connection with the criminal justice system across the population. So fully 50% of the adults with some jail or prison, more for chronically homeless individuals, and youth, obviously they haven't had a tremendous amount of time, but still, they're reporting more than a third with some history with incarceration. Juvenile detention rates, very consistent with that. adult probation rates, between a quarter and a third for all those populations. And parole, which is release from supervised release from the state prison system as opposed to the county jail system. Rates in 1 in 5 to a quarter. Obviously, the youth would fall into that category. Youth are not typically in that system. Histories of domestic violence, as I said, there's quite a disparity in the reports between men and women. The question does straddle across sexual abuse, so there are significant histories being reported in there. But there's also a significant increase for youth, but also people with gender identification transgender have commensurate rates of physical abuse, sexual abuse to women in the reports that we have. But the youth report much higher rates of domestic violence and interpersonal violence and stalking. Obviously, one issue facing us is a real task of addressing what is a national crisis. And I wanted to just, I mentioned the veteran data earlier. I think it's very suggestive when we look at the national picture. If you look at the data from 2009 to last year, which is the last year we have national data for, they don't release the annual homelessness assessment report until December, but we have seen a steady decrease in veteran homelessness. And so, this picture, you said like, okay, well, what happened in 2009, 2010? This is a very, impactful trend. Well, what happened was we started investing in this. The federal government started to devote supportive service vouchers called Veterans Affairs Supportive Housing Program, which is a Section 8 voucher connected to VA case management and supportive services at a permanent supportive housing level, and started allocating rapid rehousing resources through a separate program for lower acuity veterans. So, we spent money on it. This is a problem that responds to investment. This is a solvable problem. And it requires resources. It requires combined resources. The VASH program is a good example of that. It is a HUD voucher with supportive services. HUD vouchers don't carry any services with them. VA was not in business of housing people. Neither of those two resources can do the job on their own, but the combination of them actually drives a significant decrease in national homelessness for the veteran population. Key resources, obviously we need housing. We need to focus on housing first, which has been a demonstrated best practice in terms of getting people into housing and wrapping the services around them. We need permanent supportive housing, which is an enduring rental subsidy with a deep supportive service base attached to it. Rapid rehousing, which is a shorter term assistance with lighter touch interventions on the service side. Obviously, we need prevention and diversion upstream for people falling into homelessness. We need a coordinated entry system that connects all of the services and binds them into a comprehensive system as opposed to multiple programs. We need systemic linkages back out to the mainstream systems: healthcare, mental health, all of the other benefits to which people are entitled and need to be connected. And then, of course, with formerly incarcerated folks, we need really effective reentry programs. You're going to hear more about that, obviously. We have a truly historic moment of opportunity in Los Angeles County right now. I'm sure that you are all aware that both the city and the county went through significant public processes, developing strategies to address homelessness. And in a tremendous effort at cross-fertilization and collaboration, both of those plans inform each other. They're working extraordinarily collaboratively. As a joint city-county agency, we are in the sort of focal point, but we are engaged in a lot of the collaboration that's going on there. It's a tremendously powerful moment of opportunity between the homelessness strategies and the initiatives that have been put forward by the county and by the city of Los Angeles. And those are ongoing, they're multifaceted, there are many different areas of engagement. They focus from the issues of developing new housing and making new stock available, all the way through to the end of reintegrating people into community after successfully transitioning through a permanent supportive housing. So I encourage you to reference those plans and